Hello from ZTN Studios in Harare, Zimbabwe. Welcome to Flattening the Covid-19 Curve. Is Zimbabwe prepared? This broadcast is brought to you by Zimpaper's TV network ZTN and our partners, the Southern African Parliamentary Support Trust, SAPS, and ZimCod. Hello, I'm Andy Hodges. Now, Zimbabwe has recorded a 260% increase in COVID-19 cases within the last 10 days or so, as quarantine facilities accommodating returning citizens from neighboring countries have become epicenters of the pandemic. Since March the 20th, when the country recorded its first COVID-19 case, to May the 25th, Zimbabwe had 56 confirmed cases. But as of the 7th of June 2020, the figure had increased to 282. Most of the recorded cases were recorded at quarantine centers sheltering Zimbabwean citizens returning mostly from South Africa, Botswana and Mozambique. The country is also recording local transmissions, although at a minimal rate. The spike in COVID-19 cases has shaken the nation, especially considering that the country is approaching winter, when experts predict that the virus spreads more. It also comes at a time when some people are disregarding lockdown regulations meant to curb the exponential spread of the virus. Experts say the increase in the number of cases is directly linked to mass testing that the government has embarked on. Zimbabwe appears to be doing well in terms of flattening the COVID-19 curve, as seen by the few numbers of local transmissions. Joining us on our show today to discuss flattening the COVID-19 curve, is Zimbabwe prepared? We're joined in the studio by Dr. Fortune Nyamande, chairperson of the Zimbabwe Association of Doctors for Human Rights. And joining us virtually during the show, we'll be joined by Muchaneta Mundopa, Executive Director, Transparency International Zimbabwe, TIZ, Dr. Portia Manangaziwa, Director of Epidemiology and Disease Control at Zimbabwe's Ministry of Health and Child Welfare, and Dr. Ruth Labode, Chairperson of Zimbabwe's Parliamentary Portfolio Committee on Health. Fortune, welcome to the show.
Thank you.
Now, if you have any comments or views on our show today, please contact us via our Facebook page, Zimpaper's TV network, or via our Twitter handle at ZTN News. Now, Fortune, Zimbabwe Hospital Doctors Association has called for the government to speed up the process of setting up medical isolation centers to cater for critical patients. They have further stated that these isolation centers need to be equipped with ventilators and oxygen. So how prepared is our health sector to handle the pandemic, and what is actually the current state of the sector?
Okay, thank you for the question, and thank you for having me in this broadcast. I think the call by the Zimbabwe Hospital Doctors Association with regards to capacitating our isolation centers, it is in order, and we have been lucky, if I would say, as a country, that we have not really experienced very severe cases of COVID-19. So this partly explains the low mortality that we've witnessed. We've had about 4 deaths of COVID-19 since the onset of the pandemic in Zimbabwe. But should we add more critical and more severe cases, maybe the picture could have been different. So from the side of preparedness, it would be prudent for the health authorities and the government to make sure that we have got enough capacity to deal with critical cases should they arise. But however, I would want to mention that if we're going to look on this matter, when we're looking into, when we're considering that we've got limited resources as a country, I would advise the government to prioritize prevention, to prioritize testing, to prioritize containment of cases from the quarantine centers and the exogenous importation of cases into Zimbabwe. Then after we are sure that we are not bringing a lot of cases into the country, then we also then make sure that we've got a good capacity to deal with critical and severe cases of COVID-19.
So you're saying that the current health sector as we have it now is okay to manage the cases that we have, and if there was a spike, what would then be the issues?
No, I'm not saying that we've got enough capacity to deal with the existing cases, but I'm just saying at the moment we have, as of yesterday, we have 282 cases. Confirmed cases of COVID-19. But if you're going to look into how they are graded clinically, mild, severe, and very severe cases of COVID-19, we have had mostly mild cases of COVID-19. So I would say that in the event that this pandemic worsens and we have more severe cases, we may witness a higher case fatality rate or case fatality ratio in Zimbabwe.
And obviously more equipment would need to be brought in, ventilators, oxygen and so forth.
Definitely, particularly in the public hospitals, in the district hospitals, in the district isolation centers, because we've seen most attention being paid to Wilkins and probably Thorngrove in Blawayo. But we've got a lot of other COVID-19 designated centers which do not have that equipment across the country.
Right, now joining us virtually on the program is Muchaneta Mundopa, Executive Director, Transparency International, Zimbabwe TIZ. Muchaneta, good afternoon.
Good afternoon, Andy, and good afternoon to the viewers.
Now, Muchaneta, Zimbabwe acceded to the International Covenant on Economic, Social and Cultural Rights back in 1990, which requires that the state take steps to the maximum of available resources to progressively achieve the full realization of, amongst other issues, the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. In your view, has progress been made to achieve this goal?
Andy, thank you for the question. My first point of call will be, in April 2001, African Union countries, including Zimbabwe, met and pledged to set a target of allocating at least 15% of their annual budget to improve the health sector. But as you saw from the Minister of Finance 2020 budget, the health sector was only allocated 10%. So that on its own is a starting point to say we are not yet prioritizing healthcare as we set out to do so. You'll also note that globally, $7.35 trillion is spent on healthcare annually, but 455 billion is lost to fraud and corruption. That's leading to negative effects on the attainment of the Sustainable Goal number 3, which relates to health. Without meaningful action against corruption, progress towards the attainment of the healthcare is being hampered. So in my opinion, we are not yet fully where we're supposed to be in terms of universal health coverage, because as you'll note right now, the inequality gap between those who have and those who do not have is continuously being widened, especially in terms of healthcare.
Now, your organization previously carried out a study on strengthening anti-corruption advocacy in the health sector. What recommendations have you made to the government based on that report or other reports you have done?
The first point of call was for us to have a national anti-corruption strategy, because what you've noted that in the anti-corruption fight, we have different stakeholders, but each doing their own thing. So there was need for us to reach a coordinated framework and also fight towards the same thing, prioritize sectors that are impeding on people's rights, for example, health. So we're happy to say that ZAC, the Zimbabwe Anti-Corruption Commission, is in possession of the strategy and it has been finalized. But also in terms of the broader view as Transparency International, we say that in as much as it is important to investigate and punish perpetrators of corruption, especially within the health sector, it is also important to view corruption from a human rights perspective. Why not adopt a human rights approach in the fight against corruption? One where we put the victims, and I've always said that corruption is not a victimless crime. Victims of corruption are the ordinary citizens who rely mostly on public institutions such as public health care. So one way is to empower citizens to be able to demand. First of all, we must teach the general citizens about their rights so that they are able to demand transparency and accountability from the relevant stakeholders. We also need to promote good governance approaches centered on the rule of law, transparency, accountability, and participation. Transparency, Andy, in particular, is key to mitigating the risk associated with corruption. It entails that information is publicly available, there is open contracting, we adopt procurement procedures. Also, accountability ensures that public officials, the process of decision-making is transparent and they're held accountable for the decisions that they come up with. So I think putting emphasis on principles of good governance as enshrined in the Constitution is a key factor.
Now then, finally, do you think that Zimbabwe has successfully been able to flatten the COVID-19 curve?
I would say, and from our point of view, yes and no. Yes, in the fact that we have, compared to other countries, our numbers for COVID-19 positive cases are not that much. But then no, in the sense that I do not think we are prepared as a nation should the numbers blow out of proportion, I'm of the opinion that our healthcare sector cannot cope with the numbers.
Muchaneta Mundopa, Executive Director, Transparency International, Zimbabwe, TIZ. Thank you very much.
Thank you very much, Andy.
Now, Fortune, you heard what Muchaneta said, just a bit of a recap. I think the first issue I'd like to talk to you about is the fact that I think the generally accepted standard of healthcare budget should be around 10% of the budget, and we're not yet hitting that. And I think that's one key area she mentioned. And also, of course, recommendations to government. She talked about transparency, accountability. Now, you heard her recommendations. Would you have any comment on what she said?
Yeah, I think she raises some very valid and powerful points, particularly, firstly, like on the allocation of resources to the Ministry of Health. Traditionally, we've seen that we've never surpassed 10% of our national budget to healthcare, despite the government being a signatory to the Abuja Declaration. So that in itself is a violation of the right to healthcare, because there's no way we would expect to get people to get healthcare services when the Minister of Health is grossly underfunded. And secondly, it is also very important to note that on what is allocated, if they allocate 10%, it is not all the 10% that is disbursed during that fiscal year. So the allocation is actually much lower than what we see in the national budget. Then also, I agree with you entirely that we also need to view corruption from a human rights perspective. Myself, coming from the Zimbabwe Association of Doctors for Human Rights, we've seen the ordinary poor, the people from the rural communities, the farming communities, failing to access healthcare because of the work of corruption. I'll give an example of one of our central hospitals, Chitungwiza Hospital, which is a referral hospital which provides catchment services for Mashonaland East and very other areas which are so far away from Harare. That hospital has been entirely privatized, and the way and the manner in which it was privatized does not leave a good record. There's no transparency, there's no accountability. We have seen records from the previous permanent secretary, Dr. Gwinji, calling for an audit on how the public-private partnerships at Chitungwiza Hospital, for example, were set up. And what we see, the net effect is privatization of public healthcare services. People have to pay for private mortuary services, private pharmaceutical services, private laboratory services. So this is all the work, the handwork of corruption, and it exacerbates unwanted mortality and morbidity from things that could be avoided. And corruption is a cancer that is killing our healthcare system. And we think that it's time that both civil society and government should act decisively on corruption.
Now, we have to take a breather now, but if you have any comments or views on our show, please contact us via our Facebook page, Zimpapers TV Network, or via our Twitter handle @ZTN News. You're watching Flattening the COVID-19 Curve. Is Zimbabwe prepared? This broadcast is brought to you by Zimpapers TV Network, ZTN, and our partners, the Southern African Parliamentary Support Trust, SAPS, and ZimCod. After the breather, we should hopefully be joined by Dr. Portia Manangazira, Director of Epidemiology and Disease Control at Zimbabwe's Ministry of Health and Child Welfare. Don't go away. We'll be right back. Welcome back. Our discussion this afternoon, flattening the COVID-19 curve. Is Zimbabwe prepared? This broadcast is brought to you by Zim Papers TV Network ZTN and our partners, the Southern African Parliamentary Support Trust, SAPS, and ZimCod. Now, Fortune, before the break, we were talking to the Executive Director of TIZ, who was talking about some of the issues in the hospital sector and so forth. But one thing that we've seen in Zimbabwe is an upsurge of COVID-19 cases, principally emanating from COVID-19 quarantine centers. Now, what steps do you think should be taken to make them more secure? And also, what do you think are the main reasons why people are escaping from such centers?
Okay, thank you for the question. I think we need to relook the whole aspect of quarantine and isolation in Zimbabwe. And we also need to go back to the principles. Quarantine and isolation are provided in international human rights frameworks, and we can even refer to the Syracuse principles, which outline how governments can actually implement quarantine in a manner that respects human rights and also that promotes public health. What we have seen in Zimbabwe is, firstly, even from the pronouncement by the president, that when people get into quarantine centers, they're supposed to be tested on day 1, day 8, and day 21. This is not being followed. We have a clear example of people who went into a quarantine facility at Girls High School, and they arrived on the 10th of May. They were only tested on the 24th of May. So these people were living in quarantine centers for 14 days without being tested. So this poses a real possibility that these people can act as a foci for transmitting COVID-19 to other residents of the same quarantine facilities within the 14 days. Furthermore, they were tested on the 24th of May, but they only had to receive their results on the 28th of May. So we have people who are staying in the quarantine facilities for 18 days without knowing their status with regards to COVID-19. Secondly, we have about 16 people staying in one dormitory. 16 people staying in one dormitory. This means that social distancing is not possible in such circumstances. We've got people fetching water 200 to 300 meters away using buckets. Without soap, they don't have access to soap and other sanitary and proper ablution facilities. So what we're saying is that it's not, in my view, I wouldn't think that these people are coming with COVID-19 from outside the country. Maybe, yes, we've got some cases that are coming from outside, but there's a real possibility that there's a lot of local transmission that is happening within the quarantine facilities. And to us, this is a violation of the right to health. No one should be subjected to be put in a place where their health and their lives are put to risk, and where to take legal action. And the High Court, in this past week, it gave an order that the quarantine facilities must be upgraded to the right facility, to the right standards as provided by the World Health Organization.
Now, contact tracing is obviously one very strong weapon to fight the spread of COVID-19. Are we implementing that to the fullest ability that we have, that contact tracing, to identify the COVID-19 positive patients that have and who they've gone to, like in similar countries around the world?
Yeah, I would think so, that for the cases that we've had of local transmission outside the quarantine facilities, I think we've seen our government teams doing remarkably well in terms of trying to identify most of the contacts, to say who have you been in contact with, and trying to chase the whole chain of transmission, possible transmission. But coming back to the previous question, most of our cases have not been as a result of the local transmission within the communities. They've been a result of local transmission within the quarantine facilities. And in those circumstances, how do you do contact tracing in people who are confined at a certain school or at a certain teachers' college? It's very difficult when they don't have adequate mechanisms to maintain social distancing, when they don't have adequate ablution and hygiene facilities. So I would think that outside the quarantine facilities, the government and its partners, they've been doing remarkably well in terms of trying to contain the spread of COVID-19 within the communities. Although we also do not have quite a lot of evidence to really assess what is the true extent of COVID-19 in the general population.
I think that's my question, because obviously testing is critical, and it appears that the increase in COVID-19 cases can go up based on testing. How is our testing program at the moment in the country?
Our testing, I would say initially, when we were responding to the COVID-19 pandemic, I would describe it as initially it was lethargic. Our testing was not up to the required standard, I think around March and April. But of late, we've seen an increase in the number of tests that are being done. Although we do have reservations about the use of the RDT test kits versus the PCR test kits, we still think that there's room for government to do more PCR-based tests, because these ones are more definitive, and they give us an accurate clinical picture of whether someone has COVID-19 or not. But we would say that the government needs to move into the communities and test people so that we see whether or not we have COVID-19 within the communities.
Do you have any numbers of how many people have been tested in the country at the moment?
Offhand, I don't know the statistics.
But obviously we need a lot more than that.
We need a lot more than
to find the real benchmark of where we stand on the COVID-19 infection.
Yeah, definitely. The testing has been good, particularly amongst returning residents. Although it is not being done properly. They need to be tested on day 1, day 8, and day 21. And also the testing amongst health workers, that needs to be improved. The testing of clinical contacts, those who are coming to the hospitals. I think there's been some policy pronouncements in the past few weeks where they're saying every patient who gets into a hospital must be tested. But what we now see is that it's a good policy to test everyone who's getting into a hospital, but we don't have the testing facilities for the patients who are coming to the hospitals. So they're being referred to private centers. And this compromises the right to health. Someone has got a medical emergency and they cannot be attended to unless they come with a COVID-19 certificate. So the government needs to complement this policy position of testing all patients by providing the testing facilities at the public hospitals.
Now, I can say openly that, of course, frontline staff, doctors and nurses are heroes. There's no doubt about that. So I want you to expand a little bit on the protection that they have in terms of treating patients, because that's their I won't say job, it's their vocation. Both doctors and nurses. What do they require more? I mean, do they have the PPEs? Do they have the necessary masks? Do they have the necessary equipment that allows them to be safe while doing their jobs to look after the rest of us in Zimbabwe?
It's a very sad state with regards to the availability of PPEs in most government hospitals across the country. We have received reports from our members, credible reports, of most facilities running out or having stockouts of PPEs. It's only a few centers, particularly the central hospitals, which have PPEs, but not to the extent they should have. So we think that more needs to be done to protect our frontline workers, to protect our health workers, and also more needs to be done in terms of testing the health workers, because they need to be tested regularly for COVID-19 using the diagnostic PCR test kits. What we've seen is that being done is most health workers having RDT tests being conducted on them. But this, in our view, does not give us the true clinical extent of whether health workers have got COVID-19 or not.
I mean, but to be fair, the government recently announced publicly that they were importing 1.5 million test kits. That's correct. That at least will put a huge dent on the testing issue and obviously the contact tracing issue.
Definitely. We do hope that those test kits arrive and they will be distributed efficiently and transparently.
Now, I want to talk about communities. Now, communities obviously have it in their power to be effective or to participate in the fight against COVID-19. So really, from your perspective, what do you think communities can do to assist themselves and also the general population and the government to fight COVID-19 in their areas?
Yeah, thank you. I think it's the communities are a very critical pillar in the response towards any epidemic or even a pandemic. I think we've seen how communities can strengthen or can also negate any public health response program. I'll give you an example of the response to Ebola in West Africa. You know, there were some blunders which were made around involving communities around safe burials. And what we saw from that experience is that the health authorities engaged the communities at a much earlier stage and in a more appropriate manner that is culturally sensitive and that is responsive to the existing traditions and norms, I think the outcome from the Ebola crisis would have been different. So we need to draw lessons from that. Also, when we're dealing with COVID-19 in Zimbabwe, we need to engage the traditional leaders, the chiefs, the community leaders, the councillors, the political leaders at the ward level, the district level, so that they become part of the messaging, they become part of the fight against COVID-19. COVID-19 is a relatively new disease where public health practitioners are still battling to find the best strategies to deal with it. For example, we need to engage the chiefs on how do we maintain social distancing within the rural communities. We may have our own impression, but the chiefs may have a different view of what works and what doesn't work. So community engagement is a critical pillar in terms of fighting COVID-19. We also need to harness the huge network of community health workers that we have in Zimbabwe. They've been very helpful in terms of fighting against HIV, TB, and malaria, and other outbreaks in Zimbabwe before. So we've got an existing pool of skilled community health cadres whom we can use to also mitigate against COVID-19.
Now, it appears there is some concern about communication, particularly to rural areas, communication about what they should do about the COVID-19 pandemic and the issue, and the steps they should take to at least stop transmission or stop catching it from other people. Do you think that can be improved? How do you think that could be improved if you think it's not sufficient?
Yeah, I think we need to do more, particularly using the mass media, the radio, the television, which are more accessible to the rural communities. Because we've seen the urban communities who are more enlightened using social media. But now we need to find communication strategies that are more responsive to the rural communities and those who live in peri-urban communities.
Brilliant. Unfortunately, we've been unable to get hold of Dr. Portia Manangaziwa. She is the Director of Epidemiology and Disease Control at Zimbabwe's Ministry of Health and Child Care, but we will keep trying to get her on the program. We'll have to take a short breather. If you have any comments or views on our show today, please contact us via our Facebook page, Zimpapers TV Network, or of course our Twitter handle @ZTN News. You're watching Flattening the COVID-19 Curve. Is Zimbabwe prepared? This broadcast is brought to you by Zimpapers TV Network, ZTN, and our partners, the Southern Africa Parliamentary Support Trust, SAPST, and ZimCod. After the breather, we will be joined hopefully by Dr. Ruth Labode, Chairperson of Zimbabwe's Parliamentary Portfolio Committee on Health. Don't go away. We'll be right back.
Life will never be the same again.
Absolutely. No. How do you tell someone in Mbari or in Soweto that they should exercise social distancing?
Every single one of us, barring a few, are praying more.
What is the health economic cost of what we are trying to achieve?
I don't know whether his chairman knows he runs at about 9 in the morning.
Yeah, I've just got symptoms, so I just called the doctor and and then he just advised me to have to stay at home, eh?
Welcome back. Our discussion this afternoon, Flattening the COVID-19 Curve, is Zimbabwe prepared? This broadcast is brought to you by Zimpapers TV Network, ZTN, and our partners, the Southern Africa Parliamentary Support Trust, SAPS, and ZimCod. Now then, Fortune, before the break, we were talking about the issues of communication and, of course, issues about contact tracing and the quarantine centers and so forth. But ZADHR's vision is the enjoyment of the highest attainable standard of health by all Zimbabweans through a health service and health service providers that promote the right to health. So are health workers, who are frontline staff and, of course, true heroes, as I've said previously, able to fulfill this vision?
I would say yes, partly yes. We have dedicated health workers in Zimbabwe. As you are aware, most health workers, those who have chosen to remain in Zimbabwe, they are working under some of the most difficult conditions mere salaries and strenuous working hours. So I would think that we have a dedicated team of health cadres who are able to rise to the occasion and deal with COVID-19. But I would think that maybe we need to do more in terms of providing them with the tools and the motivation and the resources so that they'll be able to effectively discharge their duties. As much as the health workers have subscribed to the Hippocratic Oath, they also need to take care of their families. They also need to be protected from contracting COVID-19 in the discharge of their duties.
Now, what's the current situation in terms of healthcare workers' work standards, in the sense that I read somewhere that they've given 1 week and 1 week off or 2 weeks off, and even doctors. Maybe you could explain that, and also the testing part of it. Are they all tested when they leave, when they're on work, or when they come back? What is the situation?
I think a few weeks ago, there've been a deliberate program by government to move around in hospitals and conduct mostly RDT testing for most health workers. But this has been to majoritarily the central hospitals and some of the urban centers. But we've received reports from doctors and other health workers from primary healthcare facilities in the rural communities and also in the district hospitals who are failing to access testing. Then for those who are tested, the results are also taking quite a long, there's a long turnaround time for the results to come back. So this defeats the whole purpose of the testing program. So I think that the government needs to upscale its testing program for healthcare workers, because a health worker can also be a foci for transmitting COVID-19 to other patients and to other workers. So that should be prioritized by government.
Joining us now virtually is Dr. Portia Manangazira, Director of Epidemiology and Disease Control at Zimbabwe's Ministry of Health and Child Care. Portia, good afternoon.
Good afternoon to you. My apologies.
Oh, no, thanks.
The initial hitch.
It's nice having you on the program. Now, Portia,
thank you.
Let's start at the basics. What is the role of Zimbabwe's Epidemiology and Disease Control Unit in fighting COVID-19?
Yes. So I'm in charge of epidemiology and disease control, and I'm in the coordination pillar of the national COVID-19 response.
Okay, and then the role of your unit, the control unit, in fighting COVID-19?
Sorry, say that again.
What is the actual role of your unit or your division in the Ministry of Health and Child Care?
Okay, so my unit takes charge of emergency preparedness and response in the country. But my job is I'm the chief epidemiologist. So I take charge of all the epidemiology data, health information and surveillance within the country, and also the, control of communicable diseases.
Now, Portia, you have previously visited, amongst other sites, the U.S. Centers for Disease Control and Prevention, CDC, control room at the organization's headquarters in Atlanta, as well as toured the laboratory that ran the initial H1N1 diagnostics in San Diego. So how does Zimbabwe compare to such centers?
Okay, it's a big privilege for me to have been part of that visit. Of course, it was under the auspices of the International Visiting Leadership Program, but we were focusing on pandemic influenza preparedness, and I'm so grateful for that experience, because this has given me the confidence to be part of a national response plan for the SARS-CoV-2, which causes the coronavirus infectious disease of 2019. Because then we were able to model our national preparedness and response plan, yes, according to the WHO guidelines, but also in accordance with the pandemic influenza preparedness. Soon after visiting the States, I was able to plan and implement H1N1. Remember the swine flu? So we were able to do the response in the country, which included planning and deploying vaccination for H1N1.
Yeah, in fact, that's my question. Sorry.
I want to say, how do we compare? And I would say structurally, in terms of our surveillance and reporting, we've got very good data within the country and a very robust surveillance system. And this is what has allowed us to get the alerts. When we get to the laboratory services, it's something else. We have been working on improving our capacity, even including raising the biosafety levels for our National Microbiology Reference Lab and a few strategic laboratories in the country. But I would say we have a lot more work to do so that we achieve the requisite biosafety levels for our laboratory system. So the health system itself also needs to improve, but structurally we have a very good and well-built system. So now, I don't rate us very low, but I can't rate us very high.
Okay.
We are somewhere in between.
All right. Now you did mention a number of successes in planning and executing public health programs, communicating those to public and lawmakers and senior health management. How have you used previous successes in the fight against COVID-19?
So I am happy that now I have a bit of history even within the system that I've served for a little over 20 years now. And about half of that has been in my role as epidemiologist for the Ministry of Health and Childcare. So, and we have registered quite a number of successes. You know, when I visited the CDC headquarters in Atlanta for the second time in 2018, it was to receive a public health leadership award. And this year, or was it last year, I received another award for fighting typhoid. Looking at the work and the system that I have worked in, I told you the data is very good, the surveillance system is very good. I've taken advantage of that and the structural robustness of our health service delivery system and put those together to advantage so that we are at a position where we are looking to eliminate cholera. And we have addressed typhoid in a way that we can also say we made a dent in the history of typhoid and cholera in this country. And building on that strength and strategy and learning, but also the fact that we have a listening leadership in this country. Look at the national cleanup campaign that was launched by the president on the 5th of December 2018. It's probably part of the reason why we've been spared, because when you look at the infectiousness and transmissibility of COVID-19, it requires a broader approach: environmental cleanliness, community cleanliness, individual. So I think we ride on some of those high-level and governance decisions that have really pushed public health to a very good leveraging position. We still have weaknesses, which is why we have had spread of COVID within the community. We have weaknesses where people can slip through and just end up in a place where they are not supposed to be and doing things that they know they shouldn't do. So this is the patching up that we need to do. But I still maintain that structurally Zimbabwe is geared for even registering more public health successes.
In fact, I want to ask you about the quarantine centers, because it appears that the upsurge in COVID-19 cases is coming principally from these centers. So bearing on your experience that you've highlighted to us, what steps can be taken to stop that happening? And also, do you think that the conditions of the centers, what steps can be taken, of course, to stop quarantine returnees escaping?
So I think it's a number of issues. Yes, the health education may not have reached everybody. We still have a long way to go in educating people. I mean, listen, this is something that happened on the face of the earth less than 6 months ago. In Zimbabwe, our first case has been in March. So the time has really been very short, and the severity of the problem so big that we haven't been able to run faster than the outbreak. So we have a gap to patch up, And even looking at the Zimbabweans that have been trying to comply and cope with the dramatic lifestyle changes, economic changes and other changes, you want to go back to them and see how best they can better cope and comply, because we still are many months or even years away from a vaccine or effective cure. So now, having said that, there are people, there are always bad eggs in any society. These are people who know the devastation that COVID-19 has caused wherever they are coming from. I mean, South Africa has registered more than 40,000 cases. That's a lot. And some of the very strong systems and economies have really shaken because of COVID-19. And they come to a country where they know they left with a lot of challenges and they want to spread an infection. I have a lot of issues with that. So one of the questions that the communities have been asking is, why don't you make the police, SEMA, and the security forces? But I'm like, these are human beings, these are adults, these are more educated people. I mean, they went out as economic refugees. They understand and they know what they are doing. So why should somebody put a lock, keep them under lock and key?
Right.
It might have to come to that, but I still have issues with having to do that on adults and educated persons.
Yeah. Now, finally, Portia, and unfortunately I have to ask you to be quite brief in your answer. What is the government's plan to roll out mass testing, not only in urban areas, but also to rural communities?
So the testing has already been rolled out, but I think there is the issue of the capacity to process the results. But I think the testing is in two ways. In public health, we want to screen people. In clinical care, you want a confirmatory test. So there's a difference in the testing and in interpretation of the test results. So, and this is what is not quite permeated to the communities, but also even to some of the professionals. So there is a scope for testing, and there is a scope for confirmatory testing, I mean the PCRs. We have done a risk assessment and risk analysis, and we know which areas have had high influenza-like illness, and this is where we would want to test. We don't want to subject everybody to COVID-19 testing. Zimbabwe is not a COVID country. We know who has arrived from where and so on. So we would want to be able to do that. And the expanded testing was announced as early as 14 April of this year.
Thank you. Dr. Portia Manangazira, Director of Epidemiology and Disease Control at Zimbabwe's Ministry of Health and Child Care. Thank you very much.
Most welcome. Thanks to you. Have a good day.
And you, ma'am. Now then, unfortunately, we are coming to the end of our show, Fortune, but my final question to you is, I've asked each of our panelists that we've had on this, do you think that Zimbabwe has done a good job in flattening the COVID-19 curve?
I wouldn't think so, unlike the previous speaker. When we're talking of flattening the curve, we're talking of reducing the number of new infections. And when we do not have data to trace the number of new infections, it is premature and it is actually irresponsible for us to say we're doing well as far as dealing with COVID-19 is concerned. The government needs to test more people, and they need to conduct credible tests across the communities so that we'll be able to have epidemiological evidence and data that shows whether we are dealing with COVID-19 to the best of our abilities or not.
Thank you very much indeed. You have been watching Flattening the COVID-19 Curve. Is Zimbabwe prepared? I'd like to thank our panelist, Dr. Fortune Nyamande, Chairperson of the Zimbabwe Association of Doctors for Human Rights, ZADHR, Muchaneta Mundopa, Executive Director, Transparent International Zimbabwe, TIZ, and Dr. Portia Manangazira, Director of Epidemiology and Disease Control at Zimbabwe's Ministry of Health and Child Care. Unfortunately, we were unable to get hold of Dr. Ruth Labode, Chairperson of Zimbabwe's Parliamentary Portfolio Committee on Health. However, we will try and get her on future programmings. This broadcast is brought to you by Zimpapers TV Network ZTN and our partners, the Southern Africa Parliamentary Trust, SAPS, and ZimCod. And if you have any comments, please feel free to contact us via our Facebook page, Zim Papers TV Network, or via our Twitter handle @ZTN News. A final comment. It can be said that Zimbabwe, like all other countries around the world, was not prepared fully for a pandemic the size and scope of COVID-19. Avoiding a spike in COVID-19 cases and ensuring that hospitals have the staff and resources to care for everyone who needs it is a reason why citizens across the country are being asked to embrace social distancing and self-isolation. By limiting our exposure to the virus right now, we can help prevent the sharp spike in cases that is overwhelming medical facilities and personnel, not only in Zimbabwe but also in all countries around the globe. The World Health Organization called for countries to test for coronavirus, something that the Zimbabwean government appears to have plans to embark on. Large-scale testing, along with isolation and contact tracing efforts, allows health services to quickly identify who has the disease and arrange for them to receive the care needed. Isolating known cases prevents them from coming into contact with others and slows the rate of transmission. Health workers' protection needs to be guaranteed. Medical facilities must have the right drugs and equipment, and more funding needs to be given to the health sector to make it more robust, efficient, and able to fully serve the medical needs of Zimbabwe citizens. Compared to other countries, Zimbabwe has been lucky. Swift action was taken, such as a lockdown, and it now appears that the country has been successful partly in flattening the COVID-19 curve. But we cannot be complacent. In the fight against COVID-19, we must all play our part. That must never be forgotten. I'm Andy Hodges. Goodbye, and you all be safe.